am dubious about marijuana. States, can pass whatever laws they choose, but I'm not sure we're going to be a better, healthier nation that if we have marijuana being sold at every corner grocery store.
Hey, man. What? What's in this shit, man? Mostly Maui Wowie, man. Yeah?
These high school boys and girls are having a hop at the local soda fountain. Innocently, they dance. Innocent of a new and deadly menace lurking behind closed doors. Marijuana, the burning weed with its roots in hell.
You are listening to the Medical Podcast, a podcast publication, part of the Pharmacy Podcast Network. The Medical Podcast is dedicated to pharmacists, healthcare professionals, and is devoted to delivering accurate, timely, cutting-edge information about medical marijuana. We will bring you the most up-to-date scientific, political, regulatory, financial, and interesting information not available on any other podcast program. Not since Silicon Valley and the technology boom have we seen the likes of any other industry that has grown this fast over a relatively short period of time. The medical marijuana industry is projected to hit the $30 billion mark in the next 5 years. The medical cannabis industry has the potential of helping billions of people around the globe, but at a significant social, economical, and political cost. Our goal is to answer some of your questions, plus heighten, enlighten, confuse, and frustrate you all at the same time. So fasten your seatbelts, keep your eyes on the road, and get ready for some fun. And now, here's your host, registered pharmacist, life student, and medical cannabis professional, Joseph Friedman.
This is Joseph Friedman with the Medical Podcast, and I'm thrilled to be here today with Dr. Leslie Mendoza Temple, who's with the NorthShore University HealthSystem, and she's also very involved in various aspects of medical cannabis in the state of Illinois. Dr. Leslie, should we call you Dr. Leslie or Mother?
Just call me Leslie.
Leslie, okay, great. Well, why don't you tell us something about you, and let's just take it from there.
So I am a family medicine physician here running an integrative medicine program here in Glenview, Illinois. It's important to note I'm not going to use my affiliations when I speak about medical cannabis. These views are expressly my own. As a former member of the Medical Cannabis Advisory Board as the chair, and also as a mother of 3, and a physician who takes care of a lot of people who have chronic conditions that make them quite sick, and that Western medicine really hasn't been adequate for their relief. So that's me.
Okay. Well, how did you get into this whole, medical cannabis process in Illinois? I mean, when did you kind of start thinking about this, and what was your first entry into it? I mean, as a well-respected physician, I mean, a lot of physicians in Illinois just aren't on board with this program. They don't really have, for one, they don't have the science or the belief that this has any benefit. But how has that been different for you?
When I learned that there was a medical cannabis law, for which I had no idea that this was all going on, I read further into it and saw the qualifying conditions and thought, wow, this is the list of the patients I see on an everyday basis in my practice, where they have tried many different interventions, surgeries, pain medications, pharmaceuticals, you name it, nutrition, acupuncture, massage, or they hadn't tried it yet, and they were looking for answers to help them feel some relief. And when I saw the list of conditions that patients would be eligible for, I thought I better learn about this or else they're going to be asking me anyway. And I really wanted to be sure I knew more than my patients did when they walked through the door. And the more that I read about this, I realized that this is a pretty viable therapy for my patients. And there was a notice on the IDPH website that they were looking for board members to be part of this advisory board. And I thought, I'll try. Maybe there are, 10 other physicians that would be an expert at this. But it turns out really no one's an expert at this in the medical community, because we pretty much just learn about cannabis as a drug of abuse and what are the side effects and the problems with addiction and impairment and so forth, but we never learned about it as a potential therapy. And that's how I got into it, is I put my name in the hat and I was selected. And then we had our first meeting as a board, which was a combination of physicians from different disciplines, pharmacists, ethicists, nurses, and a medical librarian and patient advocates, where we got together and talked about the cases that were before us through a series of hearings. And we would determine whether we thought a condition should be put before the state to add them to the list of current eligible conditions. At the first meeting, they elected me as chair.
That's fantastic. Well, I think there was other doctors that were on the panel, but what were your qualifications, or what was the decision behind that?
I just ran. It's usually
okay.
It was honestly, it wasn't a super competitive process, but
okay.
I think that really no one really knew what to expect of this group. We didn't have any precedent for something like this, and I thought, in my classic way, when I'm afraid of something, I actually embrace it, and I will try to get to know it really well, and I decided to just put my hat in the ring.
And this group was created by the former governor, or at least it was a part of the program that was created by the former governor, or at least approved by the former governor.
Mm-hmm. And we were appointed by the former governor, and then when the power shifted to Governor Rauner, then we were asked to stay on. So there were some shifts after that on different advisory boards throughout the state, but I think that they just decided to keep us.
Okay. Well, just on the topic of being on the Medical Cannabis Advisory Board, now I understand, and as sort of a person who was involved with a lot of those meetings and going to those meetings, you had a pretty exhaustive process for hearing petitions from individuals or from patients who wanted to have their condition or the condition of their loved one included on the registry. So how did that whole process work?
Well, there would be a call for adding petitions. There was a strict set of criteria of documents that the petitioner would provide. And they would have to have a letter from a healthcare provider they see. They had to provide some articles to support their case, and then fill out an application to say, I want this one condition to be considered. If the application was accepted, they were lumped into a file of conditions that we were going to vet for our first hearing, which I don't recall exactly when it was. It was about 2 years ago. Mm-hmm. And when we received our materials, we got all of the applications and the research articles and the letters. Everything was redacted so you wouldn't have any patient identifiers. And we had a chance to read through these ourselves, and then we would come to the meeting and go through each condition and all of the data that was supplied henceforth. And so, for instance, PTSD had multiple applicants, so we would evaluate the paperwork that we got, and then people who wanted to speak up at the hearing would volunteer to speak like a 3-minute discussion on why they think PTSD should be included. And some of these testimonies were closed so that they wouldn't be identified, because there are people who are using, technically, cannabis illegally and going on public record admitting that they're using it. So I thought that the patients and the advocates who did come out to speak were very brave. They were courageous to do this. And we would spend all day listening to these testimonies, listening to each other on feedback on what the implication would be to add whatever new condition we're talking about. And I would talk about what I thought was a good evidence base, or if there wasn't a very good evidence base, we would then consider how we should vote. And after that, we'd have a closed ballot vote, and then it would be announced whether a condition was passed or not.
It was an 11-panel committee, right?
Yes, I believe it was 11.
Okay.
I'll check facts on that.
Okay.
Yeah, it's been so long.
Okay, and you know what? There was some conditions that for example, one mother came in and her child was diabetic and made the assertion that cannabis was controlling her blood sugar. There was another patient that came in and anxiety was, the petitioned condition that they wanted to have on the program. So how did you regard those types of conditions? And those were not approved by the committee, but what was the thought process behind that?
Well, I think if that worked for the individual where nothing else worked, then that substance helped them therapeutically. I just needed more data on some of those conditions to say, do we have viable alternatives? Do we, in terms of treating, for instance, diabetes, we have a lot of other medications and lifestyle changes that can be promoted, but at the same time, for something that's high stakes like that, I needed a lot more evidence than what's available. Okay. So that was the challenge in saying, maybe this works for the individual, but we're asking the whole state to allow everybody who has diabetes type 1 to allow this for them when the stakes of not treating it properly with insulin, which you need, I didn't want to send a message that we're ready for that yet because the data isn't good enough yet. But for other conditions where there's no other treatment anyway, or for which we have good evidence base, like treating chronic pain, we're using opioids anyway, which doesn't have the best evidence base for all the conditions that it's already being treated for. That's where I felt that is where I think we had the most potential impact to help the public health, reduce the risk of opioid overdoses and death, which is climbing every year according to the CDC. I was also concerned about the gateway effect that opioids have on heroin use, which has also climbed, and we've also had a surge in deaths in that area. I really feel that we have to look at conditions that we would treat with any opioid, any condition, that cannabis should be a viable option to treat.
And in fact, there is legislation in Illinois to allow medical cannabis for patients that would otherwise get an opioid. So we'll have to see where that goes.
Correct.
So how many conditions were approved during the time, do you recall, during the time the advisory panel, and maybe there's a little bit of story behind this as well, the advisory panel was disbanded. So maybe you can kind of go into, what happened there, was any condition ever approved, and where all that went.
Somewhere between 9 and 11 conditions were approved in our first hearing. And after we submitted this to the governor's office, it took a really long time to hear back whether it was approved or not. By the time we were close to the deadline and even past the deadline of when they were supposed to return the decision, it was determined that none of the conditions would be passed. And there was not much explanation except that the program is not ready to be expanded. So the decision wasn't based on the merit of each individual condition. They were outright blanket denied. So that was bothersome, but initially my thought was, okay, this is a new program. We need to see how it works. Let's not rush to judgment and wait till the second hearing. And then the second hearing, we had more conditions plus the old conditions from the first hearing. And so we had those conditions that we approved plus a few new ones at the second hearing. And at that point, people were pretty hot under the collar, but I thought, let's be patient and see what happens. And it took a while to hear back from the governor's office, and then again, they were all denied. And by that time, it was pretty frustrating because we were doing our job of advising the IDPH, and there was no advice taken. Then later on with, I believe it's SB 10, there was negotiation to add some conditions on a legislative basis, not based on the Medical Cannabis Advisory Board's advice, but on some other discussions, not at our level. And PTSD was added, as well as terminal illness, plus some other good things like expanding the pilot program and reducing some of the burdensome wording of the physician certification letter so that doctors could be a bit more comfortable signing these letters. They just need to say that a patient has a condition and it's debilitating. They don't have to write that I support the use of cannabis for my patient or anything like that. So those were some good things, but in exchange, the Medical Cannabis Advisory Board, as we were disbanded, with the idea that a new one would be forming and there'd be a different format on how to entertain these different conditions. And that was a while ago, and I have not heard of any new committees being formed or any other process. I think there is one, but I have not heard of any new conditions.
So there really is no process in Illinois right now to add additional conditions unless it's through a lawsuit.
Probably, yes. I think that's the case, and we saw several lawsuits come through, and they were the plaintiffs won, and the problem is then they're going to be those conditions will be appealed. So just because the court ruled that we have to add these new conditions to the board because the court said so, it hasn't happened yet because there's an appeal process by the powers that be, and so it's really kept things in limbo, and I haven't heard any movement on that. Most recently, we've had the intractable pain condition, which I think is probably hands down the best condition to put on there. The definition of intractable is you can't do anything about it. It's the kind of pain that many different therapies are tried, and it is still significant. That's a perfect case where you would use cannabis. And we know that the plaintiff won to have that added, and that it's going to be appealed, and so yet another condition will be in limbo.
Okay. So, Dr. Leslie, how many patients have you certified?
I've written certification for over 400 people, and I've so far had about 210 of them come back to see me and saying, I got my card, because it takes about 2 to 3 months now, so I don't hear from everybody right away. And then when they come back for follow-up, then I ask them, how's it going? What dispensary are you using? What forms of cannabis have you tried? How often? How much do you spend a month? Are there any issues happening? How are you feeling? Any side effects? All the things you would do in a regular visit when you start a new medication. And I would record all of that. And we actually did an independent study of at the time, 117 people who had returned to me with some feedback. And I found that over 80% of them had some sort of improvement in sleep problems, pain, seizure reduction or seizure severity reduction, and digestive relief, nausea in particular. So that was, to me, very, very promising. So the more I saw patients saying, this is really helping me, the more I think of it pretty much top of mind when I have a patient who I know is walking in with a qualifying condition through my door.
Now, are you seeing, like, patients are going to whatever dispensary they choose, are you seeing some differences in their experiences based on the dispensary they choose?
It's all over the board. The main thing I find is folks who have not ever used this before and are really worried and scared about it, no matter what dispensary they go to, they have issues with trying to figure out the regimen and communication and the availability of the strain that they finally figured out they like, and then it's not there anymore. And what do I do now? And that's one of the frustrations that I've had, because the supply seems to be changing quite a bit. And for my patients who don't have the flexibility and wherewithal to change a mindset about trying something else, they get really frustrated. But I tell them to hang in there and get used to a certain group of or type of cannabis, and maybe you have to try a different strain that's close to what you had before, and it's an evolving process.
What kind of risks to patients do we need to be aware of, and do you see these risks being overblown by the opponents?
Well, I guess, from an opponents to medical cannabis point of view, I think the concern is that we're going to get a whole bunch of people addicted to marijuana. And I'm not seeing that happen. What I'm seeing is people coming in addicted to benzodiazepines like Xanax, and they're addicted to sleep medications and Vicodin and Norco. And I'm seeing many of my patients being able to reduce the amount of Norco or other opioids they're using. Some of them have gotten off their benzos completely. Some of them have gotten off their opioids completely, even at this early stage. It also requires like a determination and mindset. So by the time patients see me, if they know they want to do this, they need a substitute. You can't just get off of opioids and expect to be suddenly okay. They need something that helps them step down. And then I have some who we have a combination that we have to tolerate and try and keep everything as low as possible so we don't have problems with interaction.
Okay. Well, what kind of advice would you want to give to other physicians who may be listening to this on their commute into work today?
I would say if you're someone who is comfortable enough prescribing a benzodiazepine, a sleep medication, or an opioid pain reliever, you should really consider strongly whether you could certify your patient. If they have a qualifying condition, I would highly recommend looking into it. Reach past the biases that you may have learned along the way in life, and you will likely see pretty nice outcomes and very grateful patients. Now, it's not for everyone. I have found, though, that 29% of my patients had challenges figuring out their regimen, or they couldn't afford it because they couldn't afford to experiment with the different kinds, and so they gave up then. And then the psychoactivity of the cannabis. If it's got too much THC or they took too much, then they'll say, I felt really weird and high and stoned and I did not like it. So you can have that, but over time the body gets used to it, and if you keep on adjusting and taking less next time, and really maybe taking it just at night so that you could sleep through any of the side effects, I have seen patients turn things around. And then I have a handful of people who just, it's not the right medicine for them, and they tried it and we have to do something else.
And to your point on building up a tolerance or trying, starting low and going slow. I had a patient just the other day who was hypersensitive. She's got a lot of issues in her mouth and her neck. She's had teeth removed. I mean, she looks great, but from the standpoint of the pain, she's miserable. And she took an eighth of a chocolate, which is about 1.25 milligrams, and she had 6 hours of a very scary psychoactive experience. And so we had a conversation, and it's kind of hard when you're trying to figure out, okay, what do we try next for this person who now is scared to death of this based on that experience? What would be your advice?
Well, there are some certain foods that may compete with a psychoactive experience that's not working out, like black pepper, pine nuts, pistachios, orange juice, some kind of citrus. So I think when people are empowered with, okay, next time I try this, I've got some other tools, and it helps bring down the nervous system a lot when you know you have a tool. Second is to approach the next time you try it in a very relaxed manner. Come in with an open mind. She took 1/8 of it, take a 1/16 of something else that would be lower THC, CBD only. I tell folks not to give up if they have just one bad experience. I did have a patient who smoked an entire joint in one sitting. That was a bad idea. You're really only supposed to do, 1 to 3 puffs at a time, and he smoked the whole thing, which is like how many puffs right there?
There could be 15 to 20 puffs in a joint, depending upon how it's rolled.
Yeah, he was smoking it like a tobacco cigarette, which, of course, he was affected for quite a while, but, I don't know why he did that. But, we need to tell folks if they have a bad experience to take way, way less. Start with a very small amount. And the worst case scenario is nothing really happens, and you waited a while. Next time, go up a little bit more. But don't give up, because it's taking my patients an average of, 2 to 3 months to figure out their regimens. I don't know what you're seeing, Joe.
Yeah, I'm generally asking patients to give it 3 months before they give up. And 3 months of trying, various different products to find out what's going to be, their sweet spot as far as what's going to benefit them. So, okay, so I always like to ask this question at the end of an interview, and what kind of advice would you give to your younger self, based on where you are today and what you're doing?
That's a big question, because with regards to medicine and listening to people is really key. Not everybody wants to do medical cannabis. They don't all want to do acupuncture. I have removed my own agenda from when I speak to patients who have had a long and difficult journey with their chronic pain or their cancer. And you have to really honor what the person in front of you wants to do. I learned that because when I have an agenda and I try to steer things a certain way, they don't feel listened to. And I think that's a problem of Western medicine in general. We are not really given a whole lot of time to truly listen to our patients because of the way the model is set up to see as many people as you can in the shortest amount of time possible. So I have excellent colleagues who have nothing but the best for their patients at heart, but they don't have a lot of time to sift through things the way I do. So I have made sure, I will always set up my practice to have enough time to devote to patients to listen to them, and then move forward with what excites them the most to try. The other is to take care of oneself. So I wish I did that, a little bit more of that. But I'm a mother of 3 young children, 3 boys, 7, 9, and 11. So I don't know how I'm going to do that until they're high school or college at this point. But take care of oneself is key.
Well, thank you very much. That's been, fantastic. Being face to face with you, having this interview, learning more about your experience in the medical cannabis industry in Illinois. We really hope that this industry will continue to grow. I believe we are one governor away from that happening, and also becoming a permanent program. But at the same time, this is Joseph Friedman with the Medical Podcast, signing off for our second interview with Dr. Leslie Mendoza Temple from NorthShore University Health Center. Thank you so much.
Thank you.
Thanks for listening to the Medical Podcast, part of the Pharmacy Podcast Network. If you enjoyed this podcast episode, please help us by sharing the show on your LinkedIn, Twitter, and other social media networks. If you have healthcare-oriented questions or are a pharmacist or healthcare professional and want to learn more about medical cannabis, please reach out to our team by email. Send your message to medicalpodcast@gmail.com. The Medical Podcast should not be used in any legal capacity whatsoever, including but not limited to establishing standard of care or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast. Seek all medical advice and/or treatment from a certified registered licensed physician and/or pharmacist. This is not legal advice. Seek out a knowledgeable lawyer about the subject. The Medical Podcast is for general information purposes to generate meaningful conversations about medical marijuana and is not an authority on the subject from a clinical or legal perspective.